Hello, my name is Caitlin Germer, and today I'm here to discuss the effect of a scheduled low food map meals compared to a standard IBS diet on IBS-D symptoms. Irritable bowel syndrome is a gastrointestinal disorder that affects 10 to 20% of the population. Irritable bowel syndrome causes abdominal pain, bloating, and changes in bowel habits, including diarrhea and/or constipation. Once a patient is diagnosed with IBS, there is no cure, but it can be controlled by diet. A diet low in fermentable oligosaccharides, disaccharides, monosaccharides, and polyols has shown to have a positive effect on IBS patients. Previous dietary advice included smaller meals at scheduled times and food avoidance to help improve symptoms. The objective of the proposed study is to determine if scheduled meal times while adhering to the low food map diet will improve symptoms of IBS-D greater than the standard IBS diet. The research question being proposed is, do scheduled meal times while adhering to a low food map diet reduce the symptoms of diarrhea predominant irritable bowel syndrome better than a standard IBS diet? My hypothesis is the scheduled low food map meals are associated with reduced symptoms of IBS-D. Looking into previous studies, evidence to date suggests that 50 to 80% of IBS patients benefit from a low food map diet. In a meta-analysis comparing the low food map diet and a standard IBS diet, the low food map diet had positive effects on IBS symptoms, but more research was needed to prove it more effective than the standard IBS diet. In an online survey of 1,242 IBS patients, more than 50% endorsed eating smaller meals, although there is little evidence to prove its benefit. IBS patients have a longer bowel transit time. By eating multiple small meals a day, it increases bowel motility. The Bone et al. Study comparing low food map and standard IBS diets, both diets brought improvement to IBS symptoms, without one showing more improvement than the other. This study indicated that more research needed to be done with combining components of both the low food map diet and the standard IBS diet to see the effects. With a large portion of the population being affected by IBS and research showing benefits for both the standard IBS diet and the low food map diet, bringing components of both could provide more symptom relief to more patients. So participants in the study must be diagnosed with IBS-D using Rome 3 criteria. Recruitment will occur through local gastrointestinal doctors as well as primary care physicians. Exclusions will include patients who have been diagnosed with severe cardiac disease, liver and psychiatric disease, or another GI disease other than IBS. Prior to the trial, patients cannot have been following an excessively restrictive diet, and they could not be on antibiotics for weeks leading up to the trial. So our study design begins with a 10-day screening period. This is when we'll recruit our patients who have been diagnosed with IBS-D using the Rome 3 criteria. The informed consent will be given. A stool diary will be kept for 10 days, and they will take the IBS quality of life survey. And then 4 days of food intake prior to the second visit will be collected. When the patients return for their second visit, they will take the IBS severity score survey. Participants will then be randomly divided into an intervention and control group. Each group will meet with a dietitian who will provide instructions on the diet they've been assigned to. They will then follow this diet for 4 weeks. Written instructions will be given for both groups. The IBS severity score scale will be administered on day 14, and a food log of the final 4 days of the trial will be collected. The patients will then return after the treatment. The food logs will be assessed, a final IBS severity score scale will be taken, and a final IBS quality of life survey taken. Dietitians verbally assess the adherence to the diet with a final interview. In the study, the intervention diet will be a low food map diet. It will be on a scheduled time with 3 meals a day at 7 a.m., 12 p.m., and 5 p.m., and 3 snacks a day at 9:30 a.m., 12:30 p.m., and 7 p.m. Strict guidelines will be given for specific foods to avoid without mentioning the word food maps. The control diet will be a standard IBS diet with 3 meals and 3 snacks a day. Recommended meals are not too big or too small. They'll be reduced in fatty and spicy foods, coffee, alcohol, onions, cabbage, and beans, and to avoid carbonated drinks. These are the 2 surveys that will be used in the study. The one to the left is the IBS severity score scale, and the one to the right is the quality of life survey. The IBS severity score scale assesses the symptoms of IBS, while the quality of life survey assesses how the symptoms affect the patient's quality of everyday life. The data will be collected using the IBS severity score scale and the IBS quality of life survey. The baseline data will then be compared to the post-intervention data, and adherence to the diet will be analyzed using the food logs that the participants have created. A G-power was run to determine that 210 participants are required, 105 in each group. A paired t-test will be used to compare the IBS severity score before and after the trial, along with the quality of life improvement from before and after the trial. The alpha value will be 0.05 with a power of 95%. The anticipated outcome is the scheduled low food map meals will improve the symptoms of IBS better than the standard IBS diet. Possible outcomes of the study could lead to further research and the effect of the low food map diet combined with the standard IBS advice. Limitations of the trial include self-reported compliance. Confounding variables could affect the symptoms of IBS, such as physical activity level and various beverage consumption, and low food map is a restrictive diet that could lead to noncompliance. Prior to the start of the approval from the Ethics Review Board will be needed. Informed consent will be provided to the participants on what and how the study will be performed, disclose all the risks of the studies, inform the subjects the diet is not a cure, and explain the potential benefits. Thank you for your time.